If you're suffering with chronic vertigo type issues, listen carefully. I want to discuss a case that just came into our office about 4 weeks ago. She was with her husband in their Piper aircraft while, about 10,000 feet in the air when they switched the fuel tank and the engine stopped, and they did everything they could to ameliorate the situation. Thank God the husband flew planes for 40 years and he crash landed the plane right off the coast of Naples about 7 years ago. Both of them lived. However, the wife who entered our office about 4 weeks ago was suffering with chronic, intractable vertigo every day, every second, ever since. Chronic headaches, chronic cognitive problems, couldn't sleep at night. And obviously that type of trauma, when you have that type of impact, that can cause structural problems in the spine. She had exhausted all the medical options. Nothing seemed to help. Was referred into our office. We took 3D imaging of the upper neck, and in her case, we found that the top vertebra was structurally locked out of position under the skull. Got her corrected, which allows the central nervous system to function better. There's a huge interplay between the balance centers. So you have the inner ear, which everyone knows about, is involved in balance. We have sensory information coming from the eyes. And the one most people don't know about is there's sensory information coming in from the joints, which all is coordinated in nuclei in the brainstem called the vestibular nucleus. So often we find these people with chronic vestibular type trouble, their issues are coming from a prior trauma that they may or may not know about. And we find when we correct the structural problem, which allows the central nervous system to work better, these problems tend to fall by the wayside. This gal's only about 3 weeks in, and of course everyone's recovery happens at a different rate, but she has no vertigo anymore. She's sleeping through the night. Even her low back, which she fractured in the injury, is 50% improved. So the upper cervical spine, from a neurology standpoint, globally affects the whole system. The head weighs 10 to 12 pounds. It's sitting on this poor little bone that weighs 2 ounces. And as a consequence, as we go through life, there's all sorts of blunt type traumas that happen, whether that's a slip and fall on the ice, a snowboard injury, a surf accident, or you crashed your plane or got in an automobile wreck. Hope this video has reached people who are suffering with these types of problems, are looking for a solution, a natural solution that doesn't involve drugs or surgery. Upper cervical chiropractic is a great option that you should investigate. Thanks for listening.